The Dr. Tom Bruce Arkansas Health Impact Award is named for Dr. Tom Bruce, a native Arkansan who grew to international prominence for his work in medical education, advocacy on behalf of the underserved populations, and philanthropy. His many achievements earned him the title among his colleagues, the father of community-based public health.
Tom and I were in medical school. He was 2 years ahead of me. He graduated in '55, and I graduated in '57. But the classes were small, and the buildings were small, and so we had a lot of interchange even then.
Dr. Bruce trained in New York and London before being recruited back to Arkansas in 1974. His decade as dean of the medical school marked a period of innovation and collaborative education.
He certainly strengthened the faculty. He brought in highly qualified people to have key positions in the basic sciences and in the clinical years. He fostered the close relationship with the Children's Hospital and the VA Hospital. And they've, as you know, have become key parts of the whole medical enterprise as far as education goes.
Dr. Bruce was deeply concerned by the lack of physicians in Arkansas's small towns and rural areas, and he worked to develop a network known as the Area Health Education Centers, which provided physicians to these rural areas.
Thinking about Tom as a person and how he functioned as a dean, he was a very calm person. I'm sure he got angry periodically, but it wasn't apparent. And he was a kind, calm person. He had a lot of striking ability to propose a solution to things around the table when people were talking about a tough problem and couldn't agree. He would propose something that we hadn't thought of, and calmly, and everybody said, wow, we hadn't thought of that.
So Dr. Bruce's work has been memorialized in his writings on rural health. Other states have used his work as a model to advance their programs. I can always remember Dr. Bruce talking about his dreams for public health because I really knew he was involved in thinking about it when he used to jiggle the coins in his pockets. I knew he was paying attention and he was sharing from his heart when he did that.
Dr. Bruce continued his work to improve rural health at the W.K. Kellogg Foundation in Michigan from 1985 to 1997 and provided leadership to the National Community-Based Public Health Initiative beginning in 1990. Returning to Arkansas in 1991, he and his wife Dolores would soon serve as the cornerstone for a new entity just taking shape that would carry on his lifelong crusade for public health in Arkansas.
The Robert Wood Johnson offered a program to various states, including Arkansas, to look at questions about health of the population. And it turned out we needed a way to apply for that. And we didn't have the structure that Robert Wood Johnson expected, and so we said, well, we have an idea about that.
And we were over at Freeway Medical Towers and scratching our head, and Tom Bruce was there, and as I remember, Joe Bates was there, and we just didn't know where to turn because we had to get something. We had to get an activation potential. We had to get over the activation potential to get something going. And Tom thought about it and spontaneously said, well, let me talk to Dolores, his wife, and they would probably give us $100,000 to get ACHI started.
And it was a major contribution, and that plus the Robert Wood Johnson Foundation allowed the authorities at the medical school to allow us to make a very big grant proposal to the Rockefeller Trust, again with Dr. Rick Smith's leadership. And all in all, that led to the creation of the Arkansas Center for Health Improvement.
Dr. Bruce never declined an opportunity to serve others. In 2001, he became Dean Pro Tem of the new College of Public Health at UAMS, funded by the Tobacco Settlement Proceeds Act. He was also the first Dean Pro Tem of the Clinton School of Public Service. Through their generosity and community involvement, Tom and Dolores left their mark on many elements in Arkansas, from projects funded by the Arkansas Community Foundation to the flower beds at Wildwood Performing Arts Center to the fountain at UAMS, which stands in Dolores' honor.
I'm sure, I don't know this for a fact, but I'm sure that Tom and Dolores gave some money for the College of Public Health, and the big Commons room is named the Bruce Commons, which goes along with Tom and Dolores' idea of bringing people together in a space and a function for people to be able to be together and share ideas, and where students and faculty and people from the community could work together.
I remember one evening when we were having a dinner strategic planning meeting, and Dolores Bruce used to come with her husbands during those set times because she enjoyed hearing the banter at the table about what could be possible. She was a great inspiration to him, and we all knew it. And we were very happy that they were able to pay tribute to her with the wonderful fountain that's on the campus of UAMS. I can't go by that fountain every day and not think about Dolores, and what a wonderful partner she was to Dr. Bruce.
Arkansas has many challenges in our health and our healthcare space, as do other states. But I think what Dr. Bruce envisioned and what Rick Smith and Joe Bates and others have helped develop is a unit that brings people together. The mission is pretty important. It's a catalyst to improve the health of Arkansans. A catalyst doesn't do anything by itself, but brings people together to work for the betterment of Arkansans across the state.